All right, so we're going to go ahead and get started with Naturopathic Medicine 101. So today we're going to cover just a little bit of some of the basics of naturopathic medicine, what the principles are, what you study in school, how you practice as a doctor, and some of the career options available to you when you get out. I'm happy to answer questions as we go along as well. But more likely it'll be easier for me to answer questions after I'm done. So I'll get to your questions, and then the schools will also be available in their chat rooms for any questions that you may have subsequently. So with that, let's go ahead and get started. So I am Dr. JoAnn Yanez. I'm the Executive Director for the Association of Accredited Naturopathic Medical Colleges, and I'm joining you this morning from sunny, a little bit chilly California. But I know I can't complain about chilliness when part of the country is getting doused in snow right now. So I have been with the AANMC for about 7 years. And before that, had worked in academia. I'd been academic faculty and clinical and adjunct faculty at one of the schools with us. Also had worked in legislative efforts and public policy. Had a bit of time working in accreditation as well, and really just all the different facets of naturopathic medicine and clinical care. And so I'm really excited to talk to you all today. One of the things, and it's my first slide here, one of the things that drew me personally to naturopathic medicine was the philosophy. It was that this was a practice of medicine that was rooted in things that were important to me. As a student, as a pre-med, and some of you have asked this over the years, as a pre-med, I wanted to be a doctor. I wanted to be actually a psychiatrist because I recognized the power of the mind. But part of my interest in medicine also lay with understanding the role in nutrition, understanding that exercise was important, that our thoughts were important, that the food we put in our bodies fueled ourselves, and that was important, and that preventing disease was really powerful, and in my mind, as vital as treating disease. And so the 6 principles, when I saw them for the first time, really spoke to me with the thought of prevention, treating the whole person, identifying the cause, teaching patients how to live well, and the healing power of nature. And as I moved along in school, the other piece that really fascinated me was how NDs thought about patient care, because it was very different from the conventional model and how I had seen medicine practiced most of my life. And so when a naturopathic doctor approaches a patient care, so right now we've got the therapeutic order image up on the screen, and this is really how NDs think. When we approach a patient case, we're looking at the bottom of that triangle first, which is establishing foundations for optimal health. So that's the determinants of health. That's stress and sleep and good thoughts and good food and good water and all of the things that it takes to be healthy. And so when a naturopathic doctor is looking at a patient and symptoms, they're looking from this holistic viewpoint and checking in on those most important key foundational aspects first. Then we go up from there, and we, may start to introduce different natural therapies to stimulate self-healing or restored areas of the body that have been weakened. As you go up the pyramid or triangle, you're going toward more forceful interventions, things like medications, surgery, and even symptom suppression. And the reason that when I think of the strength and the power of naturopathic medicine is that we have all of those tools at our toolbox. We're not relegated to just, nutrition or mind-body medicine or counseling or herbs, but all of this is at our fingertips. And that's one of the things that's so satisfying about providing patient care as a naturopathic doctor, is that you get to have all of that. And so whatever is best for the patient is at your fingertips. And sometimes that can be medication. Sometimes that may be referral for surgery or things that are more invasive. But at the end of the day, NDs have as a core of their knowledge all of the above. And that is really the beautiful thing about naturopathic medicine. So very often we'll hear naturopathic students talk about they want a holistic approach. They want a deeper relationship with their patients, nutrition, prevention, all of the things I talked about. And those are really common characteristics with students. They respect the art and the science of medicine. There's often a social concern, environmental concern, but they've got to be academically successful. This is medical school and it's rigorous. And we really have to understand all of the science in order to be the best doctor. So sometimes we'll get asked here at the AANMC, am I too old or am I too young to be a naturopath? And and so the best ways of thinking about this is that there is no best age, there is no best major to be a naturopathic doctor. We see NDs from all different types of backgrounds and majors, and it really provides a wonderful diversity in the class. And so if you're thinking about, what do I do for pre-med? What do I do for my major? Find the thing that interests you. What really are you passionate about? And what do you want to study about? And then make sure, obviously, that you do really well in the prerequisite courses. So in naturopathic medical school, you're going to learn all the ologies, as I call them, the anatomy, phys, biochem, histology, etc., path. And then the clinical education gets into both conventional diagnosis and treatment, as well as all of the naturopathic tools that I talked about. There are clinical rotations that can start as early as the first year. It's a minimum of 1,200 hours in hands-on clinical training. This occurs in clinical community outreach settings, specialty focuses, in team-based approaches, and integrative medicine settings. And it's a really fabulous and hands-on way to put to practice what you learn. So all throughout the curriculum are the principles and the therapeutic order and all of the things that make naturopathic medicine unique, including the therapeutics that you learn as an ND, like nutrition and mind-body medicine, hydrotherapy, homeopathy, botanical medicine, manipulative physical medicine, alternative injection therapies, and so on. So it's really a lot to crunch into 4 years, but it is so satisfying. So we did a study, and we're actually redoing this study now. That was our alumni survey in 2015. And we asked folks what they saw, what kind of patients did they see. And so you'll see the vast majority of NDs focus on the gut, on digestive disorders, on nutrition. Women's health was high, endocrinology was high, botanical medicine use was really high across grads as well. And then we started seeing other things like fertility and pediatrics and oncology as well. So all of those are areas that NDs thrive in and focus on in their careers. So a few of you have asked about prerequisites, and I always share it's best to go to the school that you're interested in order to understand what prerequisites are they're going to be looking for, because they're for the most part the same, but there is some variation. So there are folks in all of the chat rooms now from the virtual fair available and there to answer your questions. As soon as we're done, feel free to hop over there if you have questions about prerequisites. So in general, there's bio and organic and chemistry that's required. Physics, writing classes, psychology may be required as well. But as I said, it's best to check with those schools. So ND applications and the requirements are really holistic look at you. They want to make sure that you have chosen this path, that you research this, that you're a really solid candidate to be able to go through the program. So they'll look at GPA, they'll look at your prerequisite courses, they'll look at the homework you've done to explore this as a career for yourselves. So the schools that we have available for taking classes are listed on this chart here, and they're also available at the in the different chat rooms today. So in that application material, it might be good to check in with them and find out the types of essays, what types of things they would want to see from you in your application. And as you start to think about your own application, also think about your letters of recommendation. Who is going to speak for you and share your passion in the most validating and strongest way. And those are the types of people that you want to ask for recommendations. So I know we talked a little bit about how NDs see care and what that looks like, but the typical patient visit, first off, is going to be significantly longer than most office visits in conventional model. 1.5 to 2 hours is not uncommon. Follow-up visits can be 30 to 45 minutes. And the reason that NDs spend so much time with our patients is really because we get to the root of the issue. We're understanding how much is the core of you and what is the real root of why those symptoms are showing up for you. And so as we talk, as we get into the nitty gritty, we identify those social determinants at that bottom of the triangle of the therapeutic order. We ask you about sleep. We ask you about stress. We ask you how you manage that, how you cope, how do you handle that? What's your nutrition like? What are your relationships like? We go into all of that type of information to better get a sense of the core of you and to be able to come up with treatment plans that make the most sense for what your needs are. So oftentimes people will ask, well, what are the career opportunities? What can I do as an ND? And I know Jamie put out earlier a link to our career resources page on our website, but there are so many different areas that NDs occupy in the work world. Obviously, clinical is a strong area that many people are driven to. But in addition to being, practicing clinically in either standalone offices or integrative medical centers and even some hospitals and integrated clinics, NDs are often, you're seeing them writing, you're seeing them lecturing and teaching. They may be advisors to other industries and healthcare professionals. The nutraceutical industry is strong, so that's the natural products industry, and NDs are very well poised to do well in positions within the natural products industry. But there's really so much that you can do. I always tell folks, though, think of this as an investment in your future, in your health, and in the health of your patients. And how is it that you want to use that degree? Because it might look a little bit different from person to person. So do your homework. And in doing your homework, what does that mean? It means know yourself. What are you strong at? What are you passionate about? What do you want to do when you grow up, so to speak? And then start to seek out mentors, seek out people who can help you on your path. Find doctors, shadow them. You may like how they practice, or you may not like how they practice. And all of that information is valuable. It's helpful to know what you don't like almost as much as what you do like. And so seeing a wide variety of practices is really a good way to get a good sense of what you like to do, how successful doctors have set up successful practices, and to seek out models of that. So there's all different ways of going about that. And it's really a great time to be an ND. We're seeing increases in licensure, in scope of practice for doctors, and opportunities. And that said, NDs are really enjoying high career satisfaction. When we ask them, and when you look at other professions, and there's no profession in the world where every single person that ever graduated that profession is going to be happy. But there are a lot of happy people practicing and working as naturopathic doctors, and because it is such a special profession. And so I want to leave you with that, and a thank you to all of the schools who are with us today for questions. If you have additional questions for me, I'll hang around. We also have the information up here, our 800 number and our email if you have other questions that we can help you with. And we have events coming up. So I just want to let you know about a couple of our events that are coming up. So we are going to be next week participating in Health Professions Week with about 19 other health professions. And there are lots of fun prizes and things that you can win. And then next month on December 5th, we have a webinar with Dr. Donnie Wilson on naturopathic approaches to anxiety and depression. And it's really, Dr. Wilson is a wonderful speaker, and I've known her for a long time. And I'm really excited to have her with us. And so as we move along from this setting, and I close out the broadcast, I really appreciate you all hopping into the room here, and look forward to chatting with you guys online. So thank you so much, and I hope that you all have a really great day, and I wish you so much luck along on your path, because I know that these decisions are not easy ones to make. And as you have any questions, or things kind of come up for you, we'll be here all day to answer them. So feel free to jump in and ask some questions as they come to you. And with that, I'm going to close the recording and the presentation, and hope you all have a wonderful day.